Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Congenital ichthyosis. So they are nothing but a group of hereditary disorders of keratinization. So keratinization defect is seen, and it is associated with a growth restriction, hearing impairment. So there is growth restriction, there is hearing impairment, as well as there is eye complications and infections, thermodysregulation as well. Next, we move on to the types. So the first type will be the ichthyosis vulgaris. So ichthyosis vulgaris, the inheritance, if you see, it will be autosomal dominant, and it is going to be a defect of the filaggrin. So filaggrin defect, and the onset is, it is greater than 3 months. So it is after 3 months. So the topic of discussion is ichthyosis vulgaris. So this ichthyosis vulgaris, the distribution, if you look at distribution, it is on the extensors and the flexors are spared. Next, looking at the scales, it is fine gray scales. Fine gray scales are seen. It is adherent at the center. So adherent is at the center, and it has upturned edges. Association is, it is associated with the atopy, keratosis, pilaris, palmar hyperlinearity. Next, we will move on to the treatment aspect of this. Upon treatment, it contains keratolytic and there is no retinoids. It is keratolytic and there is no retinoids. Then moving on to the second variety, that is X-linked recessive XLR ichthyosis. The XLR ichthyosis is a steroid sulfatase defect. Steroid sulfatase, and the onset is within, so less than 3 months. The distribution is, it is flexural. So looking at distribution, it is seen in the flexor aspects, flexural and periauricular. Periauricular accentuation, palms as well as the soles are spared. So scale wise, there is a dirty looking scale, dirty looking scales, they are seen. And what about association? Now moving on to the association, it is a coma shaped, it is coma shaped. Association wise, it is coma shaped, and there are corneal opacities and cryptorchidism. Cryptorchidism. The treatment wise, it is keratolytic, then comes retinoids and the learazole. Retinoids and learazole. Lastly, we look at the lamellar ichthyosis. The lamellar ichthyosis is an autosomal recessive. So, there's three varieties, it is of three classes, that is ichthyosis vulgaris being the autosomal dominant, and then we saw the X-linked recessive, as name suggests X-linked recessive. Then lamellar is AR, that is autosomal recessive. So, the defect here will be the transglutaminase. This transglutaminase is the defect, and the onset is it is present at birth. It is present at birth, and the distribution is erythroderma. It is erythroderma, and scale is fish-like scale. There is presence of fish-like scale. And what about the associations? There is fish-like scale. Association is, what is association? The association, it includes the colloidal baby, as well as the ectropion. Then looking at the treatment aspects, it is the keratolytic as well as the retinoids. Channel.